Good afternoon. This is Alan Harris, Emergency Manager here for Seminole County. It is the 14th of April, and we are doing our bi-weekly Facebook Live update where I will provide you up-to-date information on Seminole County's response to COVID-19. As I do each time when I'm with you, I like to go ahead and mention our two locations to get additional information. Once this event is over, of course, our Citizens Information Hotline, which is staffed 7 days a week by Florida Department of Health and Emergency Management personnel, and that number is 407-665-0000. Again, 407-665-0000. And our website has been updated over the last few days with additional information at prepareseminole.org. Again, prepareseminole.org. So it's got a lot of great information in there. Information on elections, the school board, the free lunch program, how to file for unemployment, paper unemployment applications that we now have available on certain sites around the county, working with our cities and the county. So a lot of great information on there. We will today be wrapping up right at 12:25, and the reason we will be doing that is the Seminole County Public Schools will now be doing a Facebook Live on the same days as us from 12:30 to 1. So Walt Griffin and his staff, the superintendent of schools and his staff, will be leading that Facebook Live. So we'll leave here at 12:25 today. If we haven't answered all your questions, just know we'll get back on and we will answer the questions in the chat boxes. But we will end at 12:25, so you can get over to the Seminole County Public Schools Facebook page so you can see Superintendent Griffin and his team, and they're going to give you an update on what's going on in the schools. So we'll be doing that so you can get over there at 12:30. I wanted to let you know here in the Emergency Operations Center, we of course have been in full operation for multiple weeks now, and one of our primary missions, of course, is taking care of the individuals that are isolated and quarantined, and another is, of course, providing personal protective equipment to those on the front line of this battle, the healthcare workers, nurses, doctors, and other medical staff. And so far, we have filled over 300 resource requests. So that's a request from assisted living facilities, nursing homes, and hospitals for personal protective equipment. That is supporting over 115 healthcare facilities. So we continue to get shipments in from the state of Florida and the federal government, and through private vendors too. So we're not just reliant on the state and federal government, although they have provided a lot of support for us. We also are looking at private vendors to get in equipment for our first responders, our firefighters, our law enforcement personnel, the people at the jail, the workers at the jail, etc. As part of that, we've sent out over 6,100 face shields, 19,000 N95 masks, 66,000 procedural masks, 67,000 gloves, 14,000 gowns, over 1,400 Tyvek suits, and over 225 care packages for individuals that are isolated and quarantined. Again, our team here is broken into a couple different groups. There's the planning group, of course, which is looking at the future, also getting statistics on the testing sites, all the information related to the situational awareness currently on this day, and then also looking at the future. We have a logistics section, which is the section I just talked about, which is providing all of those, the food to the individuals, the personal protective equipment to the healthcare workers, etc. We have an intel team, and that team is made up of about 7 to 10 people, depending on the day, and those team members are calling every single one of our confirmed cases each day to check on them, make sure that they're okay, that they don't have any specific needs. All of our monitoring patients, so those are individuals that have come in contact with a COVID-19 patient, and just to make sure that their temperatures are okay and that they are feeling all right, etc. And then patients under investigation. So those are persons under investigation. So those are individuals that have taken tests and we're waiting results back. So we contact each one of those individuals on a regular basis, the monitoring and the confirmed cases, of course, each and every day to check on them and make sure that they are okay. I wanted to give you an update on Black Bear Wilderness Area. So Black Bear Wilderness Area, our natural lands individuals and leisure services department have noticed that you're actually taking our advice. And our advice was to go out and enjoy Florida's natural choice here, Seminole County. Enjoy the trails, enjoy the bike trails, enjoy the hiking trails, the nature. So you've done it, thank you, but you've done it to a very high level. So we are having to limit the amount of people on Black Bear Wilderness Area. The trail is just, for those that have been on it, they know exactly what I'm talking about. The trail is not very wide. It's only about a foot or 2 feet in some areas. It goes right along the St. Johns River. It is quite a beautiful trail, a very nice hiking trail, but we're seeing upwards of 5,000 people on that trail each weekend day. So we're going to limit the amount of people. So once the parking lot is full, that wilderness area will be full. And of course, as people leave, we will allow people in. So we want to, of course, keep that open. We're certainly going to keep the Black Bear Wilderness Area open, just like we have all of our parks. All of our trails. We want you to be able to enjoy, again, Florida's natural choice here in Seminole County, but we want to do it safely. We have had some complaints from individuals that were on the trail that it was hard to get around people. There was no way for people not to gather in groups in certain areas just because it was hard to get around. So this is a way that we can still allow you to enjoy the parks, but also provide some safety and security for those that will enjoy it. We're asking, so there's a parking lot there at Black Bear Wilderness Area, but there is also a road along there. There's no parking on that road, so please don't try to park on the road and then walk down to the Black Bear Wilderness Area. Most of that area is residential, and there's no parking signs up and down there, so please do not park on the street right there in front of the Black Bear Wilderness Area. Just you can go ahead and go into the parking lot if there's parks available. If you do want to go to one of our other parks and trails, of course, there's lots of the Little Econ Trail. There's lots of other trails. The Wilderness Area, the Econ Wilderness Area out in Geneva. There's a lot of great bike trails, hiking trails. So please feel free to enjoy those. We ask that again you don't social distance, or I'm sorry, that you do social distance, and that you don't get in large groups of 10 or more. And I know that some people have said that it's crowded out there, so that if you go towards the trail and you see that it's really, really crowded, just maybe choose a different time to go there just to be safe. And we're trying to look out for your safety. Testing sites. So I always talk about testing sites, so I'm going to talk about them, of course, again this time, because I think it's very, very important to talk about testing sites. So I'm going to talk about the first testing site I want to talk about, of course, is the regional testing site. And the regional testing site is a site that is established by the federal government and the state government. That's the Orange County Convention Center. So they have changed the criteria for that. They've upped it to 400 tests, so that's amazing. They are now allowing anyone with any kind of respiratory. You do not have to have a fever. Anyone with respiratory type of symptoms, you can go and get in the line. Anyone that has been in contact with someone with COVID-19 can also get in the line. So they have lightened up the requirements. You don't have to have a fever anymore. You can go through the line if you have respiratory issues and or if you have been in contact with anyone with COVID-19. We also have the UCF mobile lab. The UCF mobile lab is available for those maybe in the Oviedo area, Chulliota area. That may be nice to go to that lab. That does require an appointment and will require some medical insurance. If you don't have medical insurance, the fee is $51. But again, you have to make an appointment. Here in Seminole County, we have over 23 testing sites that are available for you. That includes, of course, all 4 hospitals. It includes 3 of the standalone emergency rooms. Now, I was saying 4 before. The Heathrow emergency room, the standalone emergency room, has temporarily closed. So it's the other 3, the Lake Mary ER by Advent Health, the Orlando Health Lake Mary ER, and then the Oviedo ER, which is also an Advent Health facility. We also have all the CentraCares, which are now, which have been actually providing testing. You can go to First Choice Urgent Care in Oviedo, True Health has 4 different locations. There's one in Castleberry. I'm sorry, 3 different locations. There's one in Castleberry, there's one in Sanford, and then there's one at the Department of Health. So they are doing drive-up testing. So if you can make an appointment, they are also allowing some walk-ins. But if you can make an appointment, please make an appointment. You drive up, let them know that you're outside, and they'll come out and they'll do a swab. They are taking uninsured, underinsured, and they are also taking persons with medical insurance. So feel free to go to True Health. You can schedule an appointment. I'll give you their number. It's 407-322-8645. Again, 407-322-8645 if you're interested in doing that. And it's Department of Health, which is up there on Airport Boulevard. The urgent care of Longwood is also providing testing. So a lot of different testing sites here. And then the one, of course, there at the Department of Health would be considered a drive-through because you're going to actually drive in, you're going to park, you're not ever going to go inside. They'll come out to your car, do the nasal swab, and then that'll be that. We are looking at one other drive-through test site, and that is right now in discussions with a lab. So there's some logistics still that we have to work out on that, but we are working on that with a lab and with a nursing group of nursing individuals that will be able to come out and do that test. So we're hoping to have that online shortly. This afternoon, we will have our first Seminole County virtual county commission meeting. We did some tests over the last couple days, so we want to make sure that your input is there. If you'd like to input on any of our items, then you can certainly do so. It will be televised on SGTV, the Seminole Government Television, on Spectrum 498, and it will also be broadcasted live on our SGTV website. Yeah, so if you go to the Seminole County FL.gov website and you go over to SGTV, then you can get information on how to link in there and how to call in if you have a specific item that you would like to discuss. Then feel free to do that. Jennifer asked about, I'll try to get to some of your questions now. Jennifer asked about the risk of cross-contamination of wearing gloves. So once you wear gloves, you need to go ahead and not wear those gloves anymore. So and it's real careful. It's real important how to put on the gloves too. Try not to touch the whole, both sides of the gloves or anything like that. When you put them on, try to keep the one side all clear. And then when you pull them off, see if I can get my hand in here. You're going to want to come down here, grab, and then pull it off like that. So, of course, when I was in the fire department, we did a lot of training on just how to put on and off our gloves. Once you take your gloves off, dispose of them properly. Get to a trash can, throw them there. Please don't. Unfortunately, we've seen out in the grocery stores, people are getting to their car, they're taking off their gloves and they're throwing it right there on the ground. That means that a Publix employee or another grocery store employee is going to have to come out and pick up those gloves. So please, once you get the gloves off, you can go ahead and throw them in your trash. There's a very simple way to do that. Face masks are also very important. So Seminole County highly recommends that people wear face masks when you go to the grocery store. So, but when you do that, please make sure that you wear the face mask properly. And I know that seems simple and yes, of course, Alan, everybody knows how to wear a face mask. Well, I can tell you 50% of the people that were in the grocery store just recently when I went on Saturday were not wearing the face mask properly. They were covering their mouth, but their nose was exposed. So please, when you wear a face mask, it needs to be over the nose and the mouth. Don't touch the face mask. So once you place the face mask on, don't touch it again. There's see a lot of people that are adjusting their face mask. Well, you just lost what you're trying to do with the face mask. So try not to do that. There's a couple of school board related questions in here, and the school board again will have a Facebook Live with Walt Griffin, the superintendent of schools, at 12:30. So we certainly want you to tune into that if at all possible. They'll be able to answer all your questions related to school. So where I was trying to help a little bit, I think it's just best if we hold it off to them because they're going to be, of course, the experts. They're the folks. Jennifer wants to know about unemployment. So we have unemployment. I know the websites we've been hearing at the Citizens Information Hotline how challenging it is to get on the website for applications. So what we did here in the county is we made paper applications available. We got with each of the 7 cities. So at the 7 cities, at the City Hall, there are applications available, as well as at Community Services. So the Community Services Department is on Lake Mary Boulevard, approximately a half a mile west of Highway 1792. So it's in the Reflections Shopping Plaza. So if you go over to the Reflections Shopping Plaza, Community Services, once you pull into the parking lot, it's right there on the left-hand side, and they've got paper applications right there in the front. Lisa asks, well, when is the BCC meeting? It's going to be at 1:30 today. It is a shortened meeting. It's got some consent items, and it's got just a few things, a few other items that they want to discuss. So you can definitely tune in there. If you want to make a comment on any items, just let us know what that item is, and then you'll be called upon. You can just dial in, and you'll be able to listen, you'll be able to speak to all the commissioners. All the commissioners will be on a system that will allow them to do this virtually. So this is our first time doing it. We have seen some other commission offices across the state start to do these things. We've tried to learn from them what the best practices are. We did a test this morning at 10:30, and it worked pretty well. We had some employees that called in as sample citizens that would be calling in, and that worked really well. So I hope that we will have a great board meeting at 1:30. Mario asks, how are you preparing for the hurricane season? So this is a great question. So this is a challenge for us, right? So in emergency management, we prepare for hurricane season. This is really, we prepare for it all the time, but this month and next month, we really prepare big for the hurricane season. So this is something that we have been working on for the last few days. And it includes how we would shelter people. So we're looking at how we would shelter people in schools, still keeping with the CDC guidance. So we believe that the CDC guidance will continue through the summer. So the 6 feet distance, the 10 or less people. So we're looking. Most of our emergency shelters are in schools. So we've been in talks with Superintendent Griffin and Captain Francis, their security and emergency management office there at the school board, about how we can further use the school system. So right now, last year we used the gymnasiums, cafeterias, and large rooms. Well, that won't work this year because of the CDC guidance and because of COVID-19. So now we're looking at potentially using classrooms to be able to separate groups into smaller areas, making sure that family units are 6 feet apart from each other, if not more, if at all possible. So maybe using some more schools than we have, which of course unfortunately requires more staff. Bringing in some additional nursing staff. So those are all things that we're working on right now. There's a question about the homeless. So what are you doing about the homeless? So I can tell you at the homeless shelter, we have provided a lot of personal protective equipment, sanitizing equipment, gel for the hands, hand sanitizer for the hands, and enhanced cleaning. Food services have also been provided. So right now they have 2 weeks of supply of food there at the shelter, and we're continuing to support those individuals as best we can. There's a question about test sites. Lines are minimal. Yes, so the lines are quite low. Actually, yesterday they did get to 400 at the regional site and at the True Health site. So we've started to notice that the number of tests being requested are decreasing. So that's a determination that we've got to make. So we have to see if this is a trend, if less people are needing the tests now, which we have started to see that less people are actually asking for the tests. So if this is the case, then we will revisit how we are going to do the drive-through test site. But we're still moving forward with the drive-through test site. It will most likely be in the Altamont area, one of our most heavily populated areas. But there's still a lot of logistics to work out. We're working closely with the city of Altamont Springs, the Altamont Springs Police Department, Seminole County Sheriff's Office for security around that. There's a question about a burn ban. Is there a burn ban right now? So no, we look at the KDBI index. The KDBI index is a index that looks at fire fuel and how wet the fuel is to be burned, and the humidity levels. So right now we're in the upper 400s. If we get some rain, of course, that will lower. We need to be 500 according to county code. We need to be at 500 for a burn ban. So we're getting close. We may have to issue one, but if we get some rain, and we did see that there was some forecast for some rain over the next couple days, then that may drop it dramatically, and then there would be no need for a burn ban. Let me look and see if there are any additional questions here. There's a question about curfews. No, Seminole County has never issued a curfew. We just don't see the need to issue a curfew. So we haven't issued a curfew. So there was a question about, actually there isn't a question, but I thought someone would ask, no one asked about the boat ramps. So let me talk about the boat ramps. So we're reopening the boat ramps. So the boat ramps will be reopened probably on Thursday. We just got to do a few things around the boat ramps to clear them out and stuff. And we wanted to allow the parks team to get in there and clean and get them all prepped and everything. So we're hoping to have them open by Thursday. We found over the weekend the enhanced security from the Florida Wildlife Commission, which has committed a lot of resources to help. And also the additional helicopter flights by the Seminole County Sheriff's Office, and just responsible boat owners. And I spoke to a boat owner early last week, and he said, "You know what? I'll police it for you. If you will please open these boat ramps, I'll do it. I'll make phone calls myself and let y'all know what's going on the river." We had a really good conversation, and so we opened up the 2 boat ramps. We didn't have any problems over the weekend. It was actually quite calm. We had some great response from folks, and our goal, and we've said this since day one, is enjoy our trails, enjoy going out. We want you to go boating. We want you to enjoy Florida's natural choice. That is our motto. So Florida's natural choice. We want you to be able to go out and enjoy those things safely. So as long as those are being done safely, let's enjoy them. Let's go out and fish. Let's take the family out and go along the beautiful St. Johns River and really enjoy that. So we're hoping to have them open by Thursday, at the latest Friday, but most likely Thursday. You heard that here first. I'm actually going to announce it to the commission in about 30 minutes, but you heard it here first. Angie asked, who can I contact about healthcare staff applications? So the hospital system. So the hospitals are looking at what their surge capacity would be, what additional medical staff would be necessary for the surge, if there's a second wave, what that would look like. So there's a lot of modeling that goes into that. There's a model out of IEM that was contracted by the state of Florida that does some modeling on surge. Medical surge. Right now, it looks like in Seminole County, the ICU beds would be at about 80%. So that's good. That means that we would not exceed capacity. So that means that we wouldn't have to open an alternate hospital. Unfortunately, some of the other counties in our region are not quite as good as that percentage. The ventilator percentage, based on one of the statistics I saw, at the peak would still be okay if we do what we're doing now. And what we've done now is leveled things off a little bit. So if we continue on our trend as we are right now, leveling things off, I think that based on the statistics that we're reading, that Seminole County would fare relatively well. That doesn't mean that they won't need additional healthcare staffs. They probably will. And that they won't be utilizing most of their equipment. But even at the peak, based on one of the worst statistics, the statistic that shows, and that's what we plan for. When a hurricane's coming, we plan for a Category 5 hurricane. We don't plan for a Category 1. We're planning for a bad event. We need to do that, and even with that, then we're okay. Which test sites have the fastest results? Normally, it's one that has a lab in it. So Advent Health, CentraCares, those have labs inside of there, so those can turn those around pretty well. Kelly asked, when is Crane's Roost going to open? That is a decision the city of Altamont Springs has to make. I know that was a very difficult decision for them to close. They saw what we saw, unfortunately, at Black Hammond, 7,000 people around that lake. So they're going to have to make that decision. A lot of great questions coming in now, but unfortunately, I am at 12:25. The one last question, Mauricio, you asked about elections and the voting process. So, Chris Anderson was on our press conference. Do you remember? Was it Friday? So it was last week. So if you go back to that, he talks about the mail-in ballots, how you're going to do that, and there's information on Prepare Seminole about that as well. And we plan to have him at the 27th. So on the 27th at that press conference, Mr. Anderson will come back and he's going to talk about the election process and how to engage and things like that. Of course, polling locations at this point will remain open, but I know a lot of people want to just go ahead and avoid that and just mail in their ballot. So there's information again on Prepare Seminole. If you scroll back to the press conference when he was on there, and it'll say that in the title, you can watch his, and he did a great message on that and explained it very well. So with that, I hope these are helpful. I see a lot of good comments, so I thank you for those. And I really do hope this is somewhat helpful, and we're trying to make the best decisions we can in such a weird situation. So 12:30, please tune in to Seminole County Public Schools. Listen to Superintendent Griffin. He's going to be on in just a minute, good friend, and watch his Facebook Live. Y'all stay safe and healthy.